Hello, my name is Frances Mair. I'm Professor of Primary Care Research and Head of General Practice and Primary Care here in the Institute of Health and Wellbeing at the University of Glasgow. Welcome to our new MPC module on cardiovascular disease management in primary care. The course consists of 11 sessions and we hope that you'll find them all informative and interesting. The sessions are all delivered on Tuesday afternoons starting at 2 p.m. There's one exception to this, Tuesday the 5th of June. Unusually, this is a public holiday, so our session will be delivered at 2 p.m. on the Thursday the 7th of June instead. The overarching aims of the sessions are as follows: to provide a grounding in the epidemiology of cardiovascular disease, to provide an overview of current management of common cardiovascular conditions in primary care, and to highlight key challenges and emerging research issues and findings. Some of the sessions will be delivered by members of our department who are known to you, such as myself, Professor Graham Watt and Professor Kate O'Donnell. However, we are also very fortunate to have a number of invited experts who will also deliver sessions and share their vast experience and expertise. The main sessions provided are outlined here. First, this introduction to the module, and then a session on cardiovascular epidemiology, the big picture, provided by Professor Graham Watt. The next session is primary prevention and cardiovascular disease, challenges and tensions, and this is provided by Professor Kate O'Donnell, who is known to many of you. Session 3 is on current management of angina. This session is led by Professor Colin Berry of the Institute of Cardiovascular and Medical Sciences here at the University of Glasgow. Session 4 is on atrial fibrillation, current management and future directions. This session is provided by Dr. Derek Connolly, consultant cardiologist at the Golden Jubilee National Hospital, who is a cardiac electrophysiologist with a special interest in arrhythmias. Session 5 is on heart failure in primary care, and that's provided by myself. Session 6 is on treatment burden, cardiovascular disease, and the need for minimally disruptive medicine, and that is also provided by myself. Session 7 is on palliative care for heart failure and is provided by Dr. Karen Hogg, consultant cardiologist at Glasgow Royal Infirmary. Session 8 is on use of e-health for cardiovascular disease, provided by myself. Session 9 is on quality assurance, behavioural interventions in cardiovascular disease management, and that's provided by Susan Kennedy, NES National Coordinator for General Practice Nursing. Session 10 is on arrhythmias and devices and is again provided by Dr. Derek Connolly, consultant cardiologist at the Golden Jubilee National Hospital. And the final session is on depression and cardiovascular disease, and that's being provided by Dr. Jonathan Kavanagh, who's a reader in psychiatry within our Institute of Health and Wellbeing. I will also wrap up that session with concluding comments. A 3,000-word essay drawing on the course, professional experience and the literature will be the form of assessment. All students will be set the same fixed question, which will concern the management of an individual with a cardiovascular problem in a holistic manner. Full details of the question to be posed will be provided towards the end of the course. Why is this module important? Cardiovascular disease is a growing global challenge in the context of ageing populations. We are a victim of our own success. For example, more people survive heart attacks than ever before, and they then go on to develop heart failure. Cardiovascular disease is a high-volume problem in primary care. Primary and secondary care professionals and policymakers have much to contribute to improving outcomes. How? Through health promotion strategies, primary and secondary care prevention strategies, improved access to an ever-increasing range of pharmacological and non-pharmacological interventions. To enhance our capacity to meet the challenges posed, we need to understand the scale of the problem and the risks and opportunities for new systems of care. Cardiovascular disease handled badly leads to poor outcomes and adversely affects quality of life of patients and their carers. There are rapid advances in cardiovascular disease management. It's essential that those in primary care keep abreast of new developments and their implications. We live in an era of evidence-based medicine. Guesswork is not an option. It is essential that primary care practitioners understand the latest treatments available to patients and can provide appropriate advice. If we lack this knowledge, our patients with cardiovascular disease will suffer in a range of ways. This is why we have asked outside experts to provide updates on important issues in relation to cardiovascular disease. However, importantly, while this course focuses on cardiovascular disease, we will aim to ensure we take a holistic approach. Those in primary care with cardiovascular problems may have numerous comorbidities that impact on their well-being and their ability to adhere to prescribed therapies or enact appropriate lifestyle advice. Individual capacity to cope with treatment recommendations may vary greatly. In primary care in particular, we need to understand how issues such as social circumstances, multiple morbidity, cognitive impairment, and health literacy may affect an individual's ability to effectively engage in self-management. Thus, while we will be providing disease-specific advice, there will be sessions that strongly emphasise the need to take a person-centred approach to cardiovascular health problems, that emphasise how important it is to take account of an individual's overall physical and mental health status and well-being, and also their life circumstances. How services are configured and how we deliver healthcare matters, and these issues will be addressed during this course. The sessions will cover issues relating to management spanning from diagnosis through to end-of-life care. We will aim to provide an overview of the big picture in relation to cardiovascular disease. A list of all the sessions is available on Moodle. We will aim to ensure that there is information about the aims and objectives of each session available in advance of the session being delivered. We will also provide appropriate details of reading materials. Those within the department will make slides available to students, and we will encourage our outside speakers to do the same. You will get the opportunity in this course to hear from clinicians with a vast amount of clinical experience. You will also get the opportunity to hear about research being undertaken within our research institute that is of particular relevance to this course. We will be able to share the latest insights on cardiovascular disease management from a primary care perspective. So we want the sessions to be interactive. Feel free to ask questions. Most sessions will involve a lecture, but also group work. If you have particular queries relating to any of the specific topics or particular management problems, feel free to bring them along to discuss. We would encourage you to be able to generate topics for discussion in class, preparing beforehand and actively participating in class debates by reflecting on your experiences and sharing your knowledge with us. Most importantly, we want you to learn a lot, but also to enjoy this course. Constructive feedback will be most welcome. This is the first year we're running the course. We want to make it better every year. Thank you.